Hi, everyone. Most of you know me. My name is Lori Quarterson, and I'm the Director of Human Resources. As the number of COVID cases across the country are on the rise, we wanted to send all of you a brief mandatory training to discuss safety practices in our offices. The safety of our employees, patients, and visitors is our top priority as we navigate through this global health crisis. In order to greatly reduce the risk for an outbreak in any of our office locations and among our patient population, it is critical for everyone to comply with our company policies and procedures related to COVID-19. Please remember, you should not come to work if you have symptoms of COVID-19. Inform your supervisor immediately. You must take and record your temperature upon arriving to the office. You must indicate and record on the check-in sheet if you have any COVID-19 symptoms. You must wear your face covering and remain 6 feet apart. The CDC strongly discourages travel. If you will travel, you must inform your supervisor of your destination and comply with our COVID travel policy. We will now present a brief video with further safety guidelines.
The health and safety of our employees, contractors, and visitors are of the utmost importance. The COVID-19 impact to society and the mitigation strategies, such as social distancing and shedding prevention, have impacted how work is performed across the country. As a result, this training provides guidance for protecting anyone that requires working indoors, in close contact with others, or sharing common workspaces. We hope to minimize the risk of exposure, illness, and spread of the disease. Thank you in advance for your willingness to adopt the safety measures that are presented in this training. Together, we can break the chain. COVID-19 is caused by a new coronavirus, SARS-CoV-2. Coronaviruses are a large family of viruses that are common in people and in many different species of animals. The complete clinical picture of COVID-19 is not fully known. Reported illnesses that range from very mild, including some people with no reported symptoms, to severe, including illness resulting in death. The virus spreads mainly from person to person, between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or nose of people who are nearby and possibly be inhaled into the lungs. You may also contract the virus by touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes. In light of how COVID-19 spreads, along with evidence of the widespread COVID-19 illness in communities across the country, you are required to wear a cloth covering to cover your nose and mouth when near other people, working indoors, and sharing a common work area or surface. This is to protect the people around you. You still may be infected, but do not have symptoms. Knowing the pros and cons of different face coverings will help you understand why a face covering is more appropriate for certain circumstances. You may not feel sick, but you could be asymptomatic. No one knows for sure if they are carrying the virus. Wearing the face covering protects others from you, and in return, they are protecting you from them. Face coverings must cover your nose and mouth. You want them to fit snugly but comfortably against your face. Remember to make sure they are secured with ties, bands, or ear loops. Face covering should include multiple layers of fabric while still allowing for breathing without any restriction. They also should be able to be laundered without damage or losing shape. When putting on and taking off your face covering, take care not to touch your eyes, nose, or mouth. Wash or sanitize your hands after handling your mask. Let's work together to ensure that N95 masks and surgical masks are available for healthcare providers working on the front line of defense against the virus. Protective eyewear or face shields should be used only in the short term, or when working in close proximity work is unavoidable. Using eyewear will accomplish two things. First, it will reduce the likelihood of drops contacting your face. Second, it will remind people not to touch their face without first washing their hands. Safety eyewear should be washed with soap and water before and after each use. Now that you have a general understanding of COVID-19, how it is spread, and the personal protective equipment used, let's go through a typical workday from sunrise to sunset. If you wake up and you're not feeling well, please stay at home. Anyone with symptoms like fever, cough, or shortness of breath should notify their supervisor immediately. Follow the CDC recommended steps to help you get through your recovery. When you are feeling better, contact your supervisor. They will share HR's return to work process with you. If you are well, but have a sick family member at home with COVID-19, or have been in close contact with someone who is symptomatic, you should immediately notify your supervisor and stay home. Even if you wake up feeling healthy, a good practice is to take your temperature. Perhaps you are concerned about contracting the virus. Maybe you have young children, or you may be caring for someone who's at an increased risk. If you do not feel comfortable for any reason, contact your supervisor to work out a plan. Don't forget to put on your face covering, bring your hand sanitizer, and a paper towel. The definition of shedding, according to the Merriam-Webster Dictionary, means to give off discharge or expel from the body. Every single one of us could have COVID-19 without even knowing it. To protect ourselves and others, we must do everything possible to prevent the shedding. Avoid areas that are not in use and avoid using office equipment whenever possible. Cover your mouth and your nose with a tissue if you sneeze or cough, and use the inside of your elbow. Avoid sharing equipment whenever possible. And if you do share equipment, disinfect the equipment before and after each use. You must regularly disinfect your own workstation, any shared work areas, and equipment. Be sure to wipe down desks, counters, refrigerator doors, microwave controls, doorknobs, shared tools, and shared machinery. During this time, it's important to eat lunch at least 6 feet away from anyone else, preferably much more since face coverings will be removed. Remember, 6 feet is a minimum distance. Stay as far as possible from other people. Particles can travel up to 26 feet. Clean your area before and after you eat. No one knows where the virus is. People can spread the virus before they ever know that they are sick. Face coverings may provide a false sense of security, and it is imperative to maintain social distances. In addition to other safety measures, avoid crowded areas and mass gatherings. Avoid shaking people's hands. If possible, avoid using any kind of public transportation, ride sharing, or carpooling.
Thank you all for viewing this video. Now, the final portion of this training, we have one additional video that is geared towards those of you who provide direct, hands-on care to patients.
Stay safe. This is your guide to wearing personal protective equipment. As a member of the home care team, you play a valuable role. Taking steps to keep yourself and others around you safe and healthy is really important. There are many kinds of viruses and other germs in the home care settings where you work, and you can't always tell when people are sick. Even people who look or feel well can be contagious, exposing others to infection. Wearing personal protective equipment, or PPE, is essential to protect yourself, your clients or consumers, and your family and friends from COVID-19, influenza, strep, and other diseases. Knowing how to put on and remove PPE correctly is the best way to prevent viruses and other germs from infecting you or the people you come in contact with. The good news is, putting on and removing protective gear is not difficult. Following some important steps each and every time will help ensure you get it right. You can do this. So let's get started. This is Miria. She'll show us how it's done. First, let's review the protective gear you may need to have with you when visiting a client or your consumer employer. Depending on the situation, you may not need to wear every piece of PPE we're about to show you. Your supervisor or consumer employer will tell you what types of PPE to wear. Generally speaking, it may include some or all of the following items: a disposable gown or jumpsuit to cover your body and arms. Make sure this is the correct size for you. A face mask or a respirator. Either a face shield or goggles. Coverings for your head and or your shoes. And gloves. In addition to your protective gear, you'll need hand sanitizer when putting on and taking off your PPE. It's a good idea to have clean trash bags on hand for disposing of your PPE after use. Let's review a best practice for putting on or donning your PPE. Make sure you put on your protective gear before you enter the client or consumer's home, or, if in a care facility, before you enter their room. Set up your trash bag now, so you'll be ready to dispose of your PPE later. If you didn't leave your jewelry at home, remove it now so it won't tear your gloves. Remember that good hand hygiene includes keeping fingernails closely trimmed and not wearing artificial nails. Start by cleaning your hands thoroughly with sanitizer. Squeeze a generous amount of sanitizer in your hand, about the size of a quarter. Rub your hands together vigorously for at least 20 seconds until your hands feel dry. Singing happy birthday twice is one way to make sure you're taking the full 20 seconds. It may seem like a long time, but it's necessary to make sure you're eliminating germs that could make people sick. Next, put on the gown or jumpsuit if you are using one. For the gown, place your arms through first. Then secure all the ties. Make sure the gown covers you from your neck to your knees, as well as your back. If using a head covering, put that on now. Make sure to tuck your hair completely under the head covering. Now, you're ready to put on a clean face mask or respirator. There are several different styles of face mask. You will use what your supervisor or your consumer employer has supplied for you. Place the face mask over your nose and mouth and secure the elastics around your ears. Make sure the mask covers your nose and extends below your chin. If it has a flexible band for your nose, gently press to fit this to your face. If using a respirator, put it on as you were instructed when you were fitted for the respirator. If you are using eye protection, put that on next. For goggles, make sure they provide good coverage around your eyes. If using a face shield, it should cover your entire face. Put shoe coverings on next if you're using them. We're almost done. But before you put on your gloves, clean your hands again for 20 seconds. Finally, put on your gloves. Pull the gloves up fully until they cover the wrists of your gown. That's it. You're now ready to enter the home or room. Now, let's review a best practice for safely taking off or doffing your PPE. This should be done outside the residence. Start by removing your gloves. It's important to do this in a way that avoids contact of your skin with the outside of the glove to prevent viruses or other germs from getting on your hands. Pinch the outside of the glove near your wrist. Peel the glove downwards, pulling the glove inside out. With your ungloved hand, slide a finger under the wrist of the other glove. Again, pull downwards, turning the glove inside out. Then, dispose of the gloves. If you're wearing a jumpsuit or gown, remove it next. For the gown, start by undoing the ties at the neck and back. Then, reach up to your shoulders and carefully pull the gown down and away from your body. Touch only the inside surface. Roll the gown up tightly, then dispose of it. At this point, clean your hands again for 20 seconds. If using a face shield or goggles, remove that next. For the face shield, carefully grab the strap and pull upwards and away from your head. Avoid touching the front of the face shield or goggles. You will need to disinfect these before your next appointment. If you're wearing a head covering, remove it now. If you will be cleaning and reusing it, place it in a separate bag. If wearing shoe coverings, remove them now. Clean your hands again for 20 seconds. Next, remove your face mask or respirator. Unhook the elastics from your ears and carefully pull the mask or respirator away from your face. Make sure not to touch the front of the mask. Dispose of the mask, or if you will be reusing it, place it in a separate bag. Finally, clean your hands once again for 20 seconds. You're now ready to move on to your next client. We've shown you the basics. Now it's up to you. Practice putting on and removing your PPE to get familiar with doing it properly. Take your time when putting PPE on and taking it off. Don't take shortcuts. And remember to change your gloves and wash your hands as frequently as you need to during your visit. Doing this correctly each and every time means you won't pass viruses and other germs to others, including your family and friends. After all, keeping people safe and healthy is what it's all about, right? Remember, your community is counting on you. You got this. You can find more information online. Thanks for watching.
Thank you all so much for participating in this training. And please remember, we are all responsible to comply with these policies and procedures to ensure the safety of all of our employees as well as our patients. So please be safe and healthy. Thank you.